You to show is, look here, this is the pancreas. This structure, what you are seeing, is the pancreas, and splenic vein just lies behind the pancreas. Hello everyone, this is Dr. Sultan Moinuddin. Welcome to Iqramed Academy. Greetings from my side. A brief introduction of mine. I am Dr. Sultan Moinuddin. I have completed my MBBS, MD and DNB from prestigious GSMC and KEM Hospital, Mumbai. With further introduction, you have seen me with multiple lectures on abdomen, on pelvis, on early pregnancy failures, etc. etc. So in this series of lectures on abdominal ultrasound, here I present you the series on hepatoportal Doppler. So in this sequential series of lectures, we will be talking about hepatoportal Doppler right from basic anatomy. So you would be having videos which are very fundamental, which deals with basic anatomy of liver, the portal vein, the hepatic artery, the SMP, and then we would see the ultrasound appearance and how they appear in Doppler, etc. etc. So before you start dealing with the technique, what I advise you is go to the basics. You understand how does a liver appear, what are the segments of liver in my previous sessions. Also look what is portal vein, how does portal vein divide. Also read about basics of Doppler so that you understand how the things would go on. Okay, I've explained in details about portal vein, how the Doppler appearance of portal vein would be in other sessions, okay, on portal vein, hepatic vein, etc. So now in this particular session, this is a consolidation of whatever we would be seeing. In this, the exact technique would be demonstrated. So I would show you that exactly on abdomen, how do we obtain the various views. So basically the most important, when we take hepatoportal Doppler, you have to look for 4 important vessels. Okay, so now let's begin with the fundamentals so that it becomes very clear. So whenever you have hepatoportal Doppler, the major vessels which we look for are 4 important vessels, right? So yeah, so let's come to this 4 important vessels. So you know that this is liver, okay. Next you have a major vein which is giving blood to the liver, which is the portal vein. Now if you see the formation of portal vein is formed by SMV. So just a revision of what we have seen. So this is SMV, superior mesenteric vein. This is the main portal vein, okay, main portal vein. And how is the main portal vein formed? By the confluence of SMV and splenic vein. So this is the splenic vein. So whenever you are doing a HP Doppler, hepatoportal Doppler, you always have to see main portal vein, the SMV, the splenic vein in 2D, and you have to apply color in them, and then you should apply spectrum in them. So fundamentals of what is 2D, what is spectrum, etc. So I'll tell you in brief what these are. So suppose there is a vessel here. This is a vessel. I just look it on ultrasound without adding any color box. That is called, we are looking the vessel in 2D. What is the importance of looking a vessel in 2D? Sometimes slow flow might be seen in the form of moving echoes of RBCs. Sometimes if there is a plaque or a thrombus, you can see echogenic content within the vessel just on 2D image. Okay. Next is, you can put a color box over this. Suppose you put a color box over this, then you start seeing color within this. So the basic 2 fundamental colors which are seen on Doppler, one is red and one is blue, right? Red and blue. So depending upon how you have adjusted your scale, okay. So suppose if you have a side scale, and as per this side scale, you have to look at the side scale, and as per the side scale, if the red is above and blue is below, that means if the flow is towards the probe, if here is the probe, then the flow which is towards the probe will look red. If the flow is like this. And if the flow is going away from the probe, so suppose if it is ulta, this is the probe and the flow is going away from the probe, then it would look blue. Okay, that is the fundamentals. So this is color Doppler. Now the next third important thing which can be done is you can put a, so suppose this is a vessel, let's come to a vessel again. So suppose this is a vessel. So 2D examination is done. Now you put a color box over this and you see that there is color flow within this. This is color Doppler examination, and suppose there is color flow within this. Now the third thing which you do is you put a spectrum within this. So there is a gate, spectral gate. So you can put a sample size FOV in this. This is called gate, and the gate can be placed, and then you have to correct the angle depending upon the flow. But just to understand, you have to put a sample gate, and then as soon as you put, you click on the enter option which is there on your knob, and then you get the waveform of this particular vessel. So when you take waveform of this, what do we call this? We call this as spectral Doppler. Okay, this is in brief the revision of the Dopplers which we have seen. Now the anatomy part, you know that there is a portal vein, main portal vein, which is formed by SMV and splenic vein. Now here the main portal vein divides into two main branches, that is the right portal vein and the left portal vein. So this is the right portal vein and the left portal vein. So till here this is very important. This is must know anatomy when you are supposed to do any Doppler. Now the next important anatomy, here purposely I would show the hepatic veins with green color so that it becomes easy for you to understand. So suppose here there is IVC, here there is IVC, then there are three hepatic veins. Okay, the right hepatic vein, then there is a middle hepatic vein like this. This is middle hepatic vein, and then there is the left hepatic vein. Okay, left hepatic vein. So there are three hepatic veins which drain into IVC. Then there is main portal vein which drains into this. Okay, so whenever you are doing the Doppler, these three vessels, that is portal vein and its tributaries. What are the tributaries of portal vein? So you have two tributaries, one is SMV and one is splenic vein. Both of them are must see. Second important thing which you have to look at is hepatic veins. So what are the three hepatic veins? You have to look at right hepatic vein, you have to look at middle hepatic vein, and you have to look at left hepatic vein. Okay, so these are three hepatic veins which you have to see. Now the third important thing which you have to look at after hepatic veins is an artery. So which artery? So I'll use a red color because it's an artery. So just anterior to middle hepatic vein, there is an important vessel which goes on. This is hepatic artery. Hepatic artery. Okay, hepatic artery. So the third important thing is hepatic artery. So these are the important group of vessels which are to be examined when it comes to hepatoportal Doppler. Okay, now with this in our brain, let's start looking at the video and let's understand how the Doppler is exactly done. Okay, so now I'll be showing you the video of this. So let's begin with. So here you have a patient who is resting. So this is the patient which is shown. The patient is resting here. We have taken a probe. So we have selected a deep probe. So now I'll show you the basics. Yeah. So now look here. This is the patient. We have selected the probe. So this is the probe. Now we are scanning for the splenic vein. So can you see here this structure, what you are able to see? This is the splenic vein. This is the splenic vein. Okay. So now look back again. An important thing what I want you to show is, look here, this is the pancreas. This structure what you are seeing is the pancreas, and splenic vein just lies behind the pancreas. Okay, so if you see here again, this is the, now you have put a color box, you have adjusted the color gain, and are you able to see that there is color flow within this splenic vein? Okay, now again we are panning through, and look here, we have come across the confluence of splenic vein with SMV, and now we have made the probe in longitudinal section. Look here, this is probe in longe, and now clearly you can see this is the SMV, okay, which is forming your portal vein at the confluence. So basically you have to trace this splenic vein till the neck of pancreas, and then you obtain this splenic vein. So this is the pancreas, and now can you see this? This is the portal vein. Okay, so this region is the SMV, this is the portal vein, and what you were seeing before was the splenic vein. So now this is where you measure the portal vein at the level of porta hepatis. So here it is 10 mm, which is the normal measurement. Now we are further looking into, so these are all gas bowels. Now sometimes you have to compress more. So whenever you are doing hepatoportal Doppler, it should be done in early morning with empty bowels. Now this is the portal vein. You are able to see here the clear cut. This is how we look for portal vein. Okay, so this is portal vein. Now this is the color flow which is applied in the portal vein. Okay, now this is application of the color flow. This is IVC behind the portal vein. Okay, now look here, we have paused the image. So this is portal vein. Here you have got IVC. This is the gallbladder, and this is the liver which lies above. Now you know that the probe is in this region. So portal vein flow is like this towards the probe. So look here, that the main portal vein is showing red flow. That means it is flow towards the probe. Okay, that is called hepatopetal flow. So the flow in portal vein in this scan is hepatopetal, that is towards the liver. Okay, this is a hepatopetal flow. Now I have applied spectrum. So now we look at this. Can you see the FOV? And this is the waveform of the portal vein which is achieved. Now we adjust the scale and decrease the gain so that proper waveform is achieved. Okay, and you have to select the PRF, that is you have to select the scale as per the venous velocities. So around 20-30 in this range you should put the velocities, so that the waveform, the morphology of the waveform is well noticed, well seen. So now look here, this is classic venous waveform, and this undulations what you are seeing, this denotes the respiratory physicity which is present in the portal vein. Okay, now this physicity is normally seen in portal vein, but sometimes when there is liver cirrhosis, the physicity increases too much. Okay, that is arterial, that looks like as if it is arterial waveform, that is in case of liver cirrhosis. Okay, so now again we are panning through the liver. Now we would be looking for the hepatic veins. Okay, so now let us look, this is GB. Now this is the sub-xiphoid view. So can you see here, and are you able to see here, this is IVC. Then once you see IVC, you should look at which vessels are moving into the IVC. So here, can you see this? This is the vessel which is moving into IVC. Okay, now look for, this is IVC, and we have applied the color box, and look this vessel which is showing blue color because it is moving away from the probe. It is moving like this towards IVC, so it is showing blue color here. Okay, and now look here, this is the portal vein. That blue colored vessel which we saw was the hepatic vein, the left hepatic vein. Now we are again spanning through, this is the portal vein, this is color flow in the portal vein. We are trying to look for an artery which lies anterior to hepatic vein. Can you see this small vessel which lies anterior to hepatic vein? This is the artery, this is the hepatic artery. So now can you see this? This is the arterial waveform. We have changed the scale, we have adjusted the gain. So now we are able to see a very good arterial monophasic waveform. Now we would be calculating the RI. Okay, so when you measure, whenever you see the waveform in hepatic artery, the next important thing you do is you measure the RI, that is resistivity index. So now we put one cursor over this, which is the maximum flow during systole, and one cursor over this, that is the maximum flow during diastole, and then machine automatically gives you the RI. So here it is 0.68, which is the normal RI for the hepatic artery. Okay, normally when the flow of liver is such that liver becomes cirrhotic, the hepatic artery becomes prominent. So in case of liver cirrhosis, hepatic artery becomes dilated, prominent, and RI of liver decreases in those cases. Now here you see this is the left hepatic vein, which is seen in the left lobe of liver. Now we are further moving in the subxiphoid. Look here. We are trying to look below the xiphoid and ask the patient to take a deep breath here. And now notice carefully, are you able to see this is IVC, and these are the three veins, the right, middle and left hepatic vein. Now this is left lobe of the liver, so this is your left hepatic vein. This is color flow within the left hepatic vein. This is IVC, and now they are trying to take a spectrum. So can you see this waveform? So this is the classic waveform which you see, which has got four waves. Okay, the S wave, V wave, S and A wave, S wave, V wave, and D wave. So it has got four waveforms, and this is tetraphasic waveform, which is classical of hepatic vein. Now very important, there is a entity which is called portalization of hepatic vein, where in case of severe liver cirrhosis you can have, and severe portal hypertension, hepatic waveform becomes like that of the portal vein. Now look here, this is right hepatic vein, and this is middle hepatic vein, which are meeting IVC. Okay, so you can see through and through, throughout the liver parenchyma, and also the ostium where it is meeting IVC. So always look at the ostium, that is the site where it is meeting IVC. It should not happen that the ostium is not well visualized. Now this is the waveform in the right middle hepatic vein. So this is middle hepatic vein. Okay, so now this is middle hepatic waveform, which is again normal. You are able to see all the four waves, 1, 2, 3 and 4 now. So this means that the hepatic veins are normal. Very important, what does it rule out when hepatic veins are normal? It rules out Budd-Chiari disease. And also look at IVC, the waveform. Now we will be trying to take waveform in the right hepatic vein also. So now this is the right hepatic vein, and here you can clearly see that the wave color is blue because it is flowing away from the probe. And now look here, in this you are getting the classic tetraphasic waveform. So this classically denotes that this is the normal right hepatic vein. Okay, so in 2D also it is normal, the color flow is normal, the color flow is hepatofugal in hepatofugal, that is away from the probe, that is towards the IVC, away from the liver. So flow in hepatic vein is normal, which is hepatofugal. And we have also seen that the waveform pattern in the hepatic vein here is again normal, which is the tetraphasic waveform. Now moreover, we are also trying to look for any other veno-venous collaterals, which you classically see in case of Budd-Chiari, but here you are not able to see because this is a normal liver. Okay, next is you also look for any other features like perihepatic collection, or you also try to look for echogenicity of the liver. So here all of these vessels are normal, the IVC is normal. Finally we move to IVC. So can you see that the flow within the IVC is normal, the IVC diameter is normal. Moreover, this is we have taken a dual section, and now see here, these are the hepatic veins which are moving into IVC. Okay, now this is the color flow into the IVC. Now this is IVC in longitudinal section. Okay, this is IVC in longitudinal section. So here you can see that this is IVC which is entering the right atrium. This is waveform within the IVC. So you can clearly see this spectral flow within IVC. So IVC is also normal here. So now the major portion, the major part, or the major methodology on which why we do the hepatoportal Doppler is, number one, to look for any thrombus in portal vein or any thrombus of splenic vein, or for portal hypertension, or to look for Budd-Chiari syndrome, that is hepatic vein thrombosis, or presence of collaterals, or to look for IVC. So these are the major purposes why we do hepatoportal Doppler. So here in this video I've demonstrated the technique of HP Doppler. I've also made one separate video where I've paused the video at various places and I have shown the anatomic landmarks and anatomic images, so that it becomes very easy and further simplified to understand the hepatoportal Doppler. So also go through those videos and send me feedback. Thank you.